Pregnancy often begins with hope, excitement, and dreams of the future. But for many families, the journey changes unexpectedly. Early miscarriage, also called early pregnancy loss, is far more common than most people realize. Yet it is rarely talked about openly. Today, we're creating space for understanding, for clarity, and for healing. Whether you are here to learn to support someone or because this has touched your life personally, you are not alone. Before we continue, consider subscribing. This channel is dedicated to honest, compassionate conversations about pregnancy, health, and parenthood, topics people often feel they must face in silence. If this kind of content matters to you, join our community. An early miscarriage is defined as pregnancy loss before 12 weeks. Most occur in the first 7 weeks, often before someone has even shared the news. Medical research shows that 10% to 20% of known pregnancies end this way. But the real number is likely higher because many losses happen before pregnancy is confirmed. This is not rare. It is not unusual. And in most cases, it is not preventable. The most important truth: early miscarriage is usually caused by chromosomal abnormalities. This means the embryo had missing or extra genetic material, something that happened at conception, completely outside anyone's control. The body recognizes that the pregnancy cannot develop normally and stops it naturally. Other causes may include hormonal imbalances, uterine shape differences, severe infections, chronic illness, blood clotting disorders. But these are far less common. In most cases, there was nothing you did and nothing you could have done differently. Let's gently dismantle some of the most painful myths. Miscarriage is not caused by exercise, stress, working, traveling, lifting something moderate, eating normal foods, having sex, feeling anxious, not being careful enough. These are everyday human experiences, not causes of pregnancy loss. Blame has no place here. Some miscarriages begin with warning signs. Others happen quietly, discovered only during ultrasound. Possible symptoms include a vaginal bleeding, cramping similar to menstrual pain, a lower back pressure, passing tissue, sudden loss of pregnancy symptoms. But symptoms vary widely, and bleeding in early pregnancy does not always mean miscarriage. Only medical evaluation can confirm what is happening. Early miscarriage is not only physical. It is emotional, psychological, and deeply personal. Some feel grief immediately. Others feel shock, numbness, confusion. Some wonder if they are allowed to grieve because the pregnancy was early. But attachment does not follow a calendar. Loss is loss, and every reaction is valid. One miscarriage does not mean it will happen again. Most people who experience early loss go on to have healthy pregnancies. Even after 2 losses, chances remain very strong. Doctors usually investigate further only after recurrent miscarriages, because statistically, most are isolated events.
Hope is supported by science.
Physically, the body often recovers quickly. Hormones return to baseline within weeks. Ovulation may resume as soon as 2 to 4 weeks. Medical guidance varies, but many providers say trying again is safe once emotional readiness returns. Healing is not just biological. It is also about when the heart feels steady again. If someone you love experiences miscarriage, you fix nothing. You do not offer solutions. You offer presence. Instead of saying, "Everything happens for a reason," try saying, "I'm here. I'm listening. You don't have to go through this alone." Simple words carry enormous weight. For generations, miscarriage has lived in silence. But silence can create shame where none belongs. Talking about early pregnancy loss doesn't make it more painful. It makes it less lonely. Every shared story builds understanding. Every conversation builds compassion. If this journey is part of your story, you did not cause it. You are not broken. And you are far from alone. Science explains much, but kindness heals more. Thank you for spending this time with us. If this video helped you understand or helped you feel seen, consider subscribing and sharing it with someone who may need it too. Let's continue changing how we talk about pregnancy, loss, and care together.